All over the world, doctors, nurses, and citizens are battling what is described as the invisible enemy. These doctors and medical staff use personal protective equipment such as masks, gowns, gloves, and goggles, which has created large amounts of medical waste on a scale never seen before. One might wonder where all this goes after it has been used. We chatted with Logan Moodley of Durban Solid Waste to find out more.
eThekwini has a large service area. We cover about 2,200 square kilometers, and that makes up about 1 million households. For that entire catchment, we collect about 3,400 tons of municipal solid waste a day, which is in the order of about 75,000 tons a month. The city does also collect other types of waste, and that adds up to a total of 1.4 million tons of waste per annum. We have a total of 3,100 staff across the entire department, but predominantly bulk of them, around about 2,000 or so, is in the operations section, which are responsible for collecting the day-to-day refuse, as well as street cleaning and sweeping of the city CBD. We receive across all the landfill sites about 1.4 million tons of waste total. Right? So to put into perspective, about 40% of that 1.4 million is solid refuse. In the lockdown phase, we had to choose the priority waste streams that needed to be collected. So in that risk assessment, the focus was on household waste. So all waste that is produced in what we call the black bag. Right? So in that process, communications did go out to the communities to ensure there's a fair level of awareness that they protect the waste collection workers by complying to double bagging the waste. So it's not where we have easy access to those. The priority is to get it bagged, sanitized, and landfill without any access in between. But at the same time, I think people's decision making as well has changed. Initially, we did see a lot of people using single-use masks, single-use gloves. These are typically what you would find in the frontline use. But with the tough economic times out there, we're seeing it around. People don't have money readily available to purchase masks. Even internally in this organization, we've shifted away towards reusable items through your cloth masks and your textile uses. But over and above that, we also took a view as a city to reach out to the communities to ensure they have a reasonable level of awareness on the day of placing the waste out for collection. So items of sanitizing the waste and double bagging it. So I think the city has come a long way in terms of educating and training and making sure there's an adequate supply for the staff in terms of the personal protective equipment. So DSW at the outset has taken the pandemic very serious because its teams are at the forefront. So the core objective is to protect lives and minimize the risk exposure of the staff. And more recently, we've adopted multidisciplinary teams to physically go out into the field, be it in a depot, in a landfill, or a transfer station, to almost play an auditor role, right? Is to evaluate the implementation or the effectiveness of the implementation at the ground level and provide that feedback to the respective management teams, who then have an obligation to act or make good on those. So it's still improvement process. I think coronavirus is still going to stay with us. There's also the stigma attached to it. So the workplace practices are changing, right? But to a point where it's an evolving document. You can almost put it in a sense that you're building trust with the staff, and we're never letting a good waste crisis go to waste.
Many countries have recommended the wearing of face masks when in public, while other countries have made this measure mandatory. The improper disposing of these masks safely can increase the risk of infection. In addition to masks, the coronavirus has been reported to survive on several surfaces, such as cloth masks and many other items we throw away. Dr. Prashanthan Moodley, a researcher at the Waste and Climate Change Chair at the University of KwaZulu-Natal, shed some light on this.
The relationship between COVID-19 and solid waste is a very interesting one because several studies have found that the COVID-19 virus survives on different types of solid waste for a variety of durations. For instance, it can survive on plastic for up to 72 hours, on cardboard for up to 24 hours. So if you think about it, these types of materials can in fact act as a vehicle to actually aid in the transmission of this virus from person to person. If you have to throw away an infected item into the waste, such as a cloth mask, there are several people within the waste pipeline who could potentially be affected by this item. The first people who are at the front line are the informal waste pickers. They generally don't protect themselves the way they would be mandated to, and in that instance they could potentially get the virus and then spread the virus. Once your item moves into the more commercialized waste treatment pipeline, of course there are the various employees within the waste treatment plant who could then be infected or affected by that infected item.
There's been a combination of appropriate engineering control measures. For example, frontline staff have screens in place, to administrative controls where there's point of entry screenings.
Another group of vulnerable people that are potentially exposed on a daily basis to the virus are informal waste pickers. We chatted with some of them to establish how much the COVID pandemic has affected them.
Since COVID began, I've been affected dramatically. For some months I was unable to collect rubbish, and no rubbish means no money. I'm still able to make some money, but much less than before COVID. I can make like 70 cents a kilo, but now with COVID it is 40 cents a kilo. When I collect rubbish, I just wear a cloth mask, but I don't wear any other protective equipment because I cannot afford to buy gloves or hand sanitizer. So when I go home, I wash with soap and water to get rid of germs.
They come from Mayville, and then some they just come from townships around. Sometimes you get nothing, sometimes you get, you see, it's depending what time you wake up, because there's too many of us now, so you have to wake up very early. See, car comes, the truck can buy from them, and they go around and recycle, and they come back, they put it together, make it wet so that it has too much weight, and then the trucks come and buy it, like 70 cents a kilo, 60 cents a kilo.
Taking all that we've heard into account, you might wonder what the scientific community is doing to address these issues.
The research group at the Saatchi Waste Climate Change is looking at a variety of studies to understand how the COVID-19 virus interacts with waste and how that in itself can serve as a vehicle to transmit the virus. So we're going to be looking at, number one, the sustainability of the virus and different types of municipal solid waste surfaces. And then we're going to be looking at how the virus survives under different environmental conditions. Using this data, we can then provide recommendations or risk-adjusted strategies for waste companies on how they should handle specific types of waste that may be potentially contaminated.
It is therefore very important for us as citizens to be cognizant of the items we dispose of and the manner in which this occurs. Additionally, we have to ensure that we sanitize all items accordingly to prevent the spread of this virus.